Welcome to Have You Heard? An IDF podcast. This podcast is a service of the Immune Deficiency Foundation, a nonprofit organization that improves the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency. People living with PI are the zebras of the medical world, and the IDF community is one big zebra herd. For years, the Immune Deficiency Foundation has worked closely with doctors, families, and legislators to improve the quality of life of people affected by severe combined immunodeficiency, or SCID. In July of 2018, in response to all 50 states and U.S. territories implementing newborn screening for SCID, the Immune Deficiency Foundation was awarded a grant through the HRSA to create a SCID screening and education program. The SCID Compass program was created with resources from that grant, and as of this fall, the program has concluded. On this episode of Have You Heard, Alissa Kramer, IDF's Director of Community Services, and Melissa Raspa, Senior Research Public Health Analyst at RTI International, take a look back over the past 4 years and explore the successes of SCID Compass. Let's get started.
Welcome, Melissa. It's really great to have you here today to chat about SCID Compass, especially since you were on the original team and we worked together throughout the program. Can you share a little bit about yourself and RTI's role and how the program initially came together?
Yeah, sure. Well, first off, thanks for having me, Alissa. I'm really excited to talk with you about the SCID Compass project and the work we accomplished together. So first, I'll just start with a little bit about myself and my role at RTI and on the project. So I've been at RTI for almost 18 years. I'm a senior scientist and I'm the director of our Genomics, Ethics, and Translational Research program. RTI is a pretty big nonprofit research institute dedicated to improving the human condition. And SCID Compass, to me, really directly aligns with our mission at RTI. So I led the RTI team for, like I said, the SCID Compass project and was involved from the start. So when our team first saw the announcement about this grant opportunity come out from HRSA, we were really excited and trying to play a role in the project, given our interests in our work in newborn screening. And to me, what was really appealing personally was the opportunity to develop tools and resources for the SCID community and hopefully help to improve awareness and knowledge among families and healthcare providers.
Awesome. Thank you, Melissa. Yeah, you and your team definitely played a pivotal role in identifying the needs of the SCID community and then translating those needs into tangible resources. Can you give a quick recap of how you gathered data and turned it into usable information?
Sure. So we decided to start by gathering some information from both parents and healthcare providers to understand the different types of resources that were most critical to develop. So first, we talked with 7 parents who had a child with SCID that was diagnosed through newborn screening. And we asked them to identify and really talk about the different key time points that they experienced in their journey with SCID. And that was starting with when they first learned that their child had a positive newborn screen, all the way through diagnosis, treatment, and ongoing management. So this activity, often referred to as journey mapping, was really critical in our understanding of their different informational and emotional support needs. So next, we conducted a survey with about 75 parents to further explore those needs. And that was super helpful because it used a larger sample of parents. Finally, we conducted a needs assessment survey with healthcare providers. So we asked a variety of providers to participate, including those who had seen a patient with SCID or tend to see patients with SCID, like immunologists, and those that don't usually see patients with SCID, like pediatricians. So that survey with healthcare providers really helped us to understand their needs, both the kind of current needs of those providers as well as future needs if they ever had encountered a patient with SCID and their family.
Thanks, Melissa. I think that's people's really biggest misconception about designing any sort of program or resource is that you really have to have the research and the data to back it up. And it does not happen overnight. Like this project took 4 years from start to finish with the development, with lots of steps, assessment, connecting with parents, connecting with providers, and really evaluating how we were doing throughout. It was a long process. So let's talk about some of those biggest needs that we heard from the SCID community and how we translated them into some sort of resource. And I think an obvious first place to start is with the website.
Well, you're exactly right, Alyssa. That needs assessment activity really drove a lot of the work that we did on the project. So those surveys and the journey mapping activities were really critical first steps. And as you said, the website was our first kind of major resource that the SCID Compass team developed. So we used those findings from the journey map activity to really guide the organization of the website. In those early conversations with parents who had a child with SCID, we really discovered that there was a common journey that all parents experienced, and that there were 5 key time points that the families talked about, even though they kind of experienced each of those time points a little differently. So first was the diagnosis stage when parents found out that the SCID screening results were confirmed that their child did indeed have SCID. And that was followed by the pre-treatment phase when parents were really seeking to determine the best kind of path forward for their child and family. The next phase was the treatment phase, where the child underwent either a hematopoietic stem cell transplant or, in some cases, gene therapy. The next was the post-treatment phase when parents were kind of playing that waiting game, waiting for the treatment to take effect. And then finally, when parents returned home, they entered the new normal phase and began that long journey of managing their child's diagnosis with SCID. So that website that we created and is still in existence today was really created around each of those different stages of the SCID journey. And IDF had some pretty wonderful resources already that we could align with each of those stages. But then, as we've been talking about, we really used each of those stages of the SCID journey to kind of think through what additional resources we could create through the project. And really, like I said, use those needs assessment, so those early journey mapping and survey results to kind of guide the development. And one of the most recent additions to the website was that really kind of encapsulated a lot of the work that we did is the SCID Compass Toolkit, which can be downloaded or printed for free.
Thanks, Melissa. Yeah, I think the website was arguably the biggest task, but it really laid the groundwork for what this program was going to look like moving forward. And we really had to create something where there was nothing for parents and providers navigating SCID. And I really think that journey map was pivotal in the design and the layout of what parents and providers and the community see today if you go to skidcompass.org. And then after that website, our program really grew and we were able to fill in the gaps and supplement other things and other items that we saw were a need, like a treatment section, which includes a really phenomenal conditioning guide, which walks caregivers through what conditioning is, why it's used or why it may not be used. But we also were able to create 2 SCID fact sheets, one for parents and one for providers that work as supplements to the newborn screening test results that states send out after that abnormal screen. Can you share a bit about how you gather accurate information in order to kind of create these additional resources like the conditioning guide and the newborn screening fact sheets?
Well, it really was a team effort for sure. So not only did we have great partners on the project, of course, IDF, but also the Association for Public Health Laboratories, or APHL, and Genetic Alliance. But we also worked with a scientific advisory board and a patient advisory board. So those 2 boards were made up of a variety of individuals like SCID experts, including clinicians, parents, and even individuals who had themselves had a primary immunodeficiency. And the board members really provided input on kind of the types of resources we should develop based on those early results from the survey and the needs assessment. But they also gave us really critical feedback along the way. We were able to also seek other feedback more broadly from parents, kind of at different stages of the project, especially as we were developing the website. And then as we worked on developing kind of other types of tools and resources for folks beyond just parents, like the fact sheets, we really worked with the state newborn screening programs or other clinicians who might not be as familiar with SCID. And then finally, for some of those really technical resources, like that conditioning guide you mentioned, we really had to sit down and kind of really take a deep dive and understand and talk with the clinical experts to really ensure that we had the most accurate and up-to-date scientific information. But it was really important to us knowing that that information was going to be translated into more family-friendly information, that we kind of took those complex medical terminologies and really put it into kind of easy to read and plain language resources.
Yeah, it was really important to both our team and to HRSA that the patient voice be included in all aspects of the program. And we are so grateful. I know we at IDF are, but I'm sure you at RTI are as well, to Heather Smith at SCID Angels for Life for being a part of our team, but also being able to connect us with so many wonderful parents as well as providers to really make sure we had that patient voice in all that we did. So Melissa, you talked a lot at the beginning about identifying the needs of the SCID community and then turning those needs into resources like the website, those fact sheets, the conditioning web pages. Were there other needs identified that the team needed to work into the program?
Yeah, indeed. In fact, one of the key findings that we identified in that needs assessment work was that parents experienced a lot of uncertainty during their child's journey with SCID. So despite getting, a confirmed diagnosis, there was still a lot of unknowns about what was kind of to follow on those different points of their journey. So as a follow-up, we conducted interviews with about 25 parents to really better understand what they meant by uncertainty and what different types of uncertainty they experienced, and honestly, how they coped with the uncertainty. It really was a really wonderful opportunity to explore those needs of parents and really kind of hear from them directly. So just to kind of give you some examples, parents talked a lot about medical uncertainty, not surprisingly. So things like uncertainty regarding finding a donor early on during that pre-treatment phase or in the post-treatment phase, whether or not that the treatment actually worked. There was just a lot of uncertainty. There were also other types of uncertainties like practical uncertainty for families or parents, like how to plan for or make it through that kind of long hospital stay, or even personal uncertainty, such as how to handle isolation from family and friends. Finally, parents also talked about existential uncertainty or those kind of big what if questions. And a good example of that was kind of some of the unknowns related to kind of the long-term implications of those treatment choices that they had to make pretty quickly.
Yeah, we learned pretty quickly that families really went through a lot when their child was first diagnosed with SCID, and they had to cope through a lot to manage all of that. And I think from the IDF perspective, this is where we felt we were really able to kind of step in and fulfill a need of sharing stories of real families who have navigated the journey of having a child diagnosed with SCID. We certainly had a lot of help in this area too, but we are grateful to so many of the families who are willing to share their stories and their journeys with our team and outlining the different types of SCID, the different hospital experiences, how they navigated it as a couple, as a family, and the things that they struggled with and the things that they really felt that they benefited from as they were on their journey. So I know if many people are looking at the website, they'll find such a diverse array of SCID stories that kind of span all aspects of the SCID journey, from that diagnosis, treatment, into that new normal. So hopefully that gives a lot of hope for parents who may be embarking on a journey of their own. Also, these stories are really some of the most popular and frequently visited areas of the website, which is really heartwarming to know that we're really able to shine some hopeful light for these parents.
With the holidays just around the corner and travel back in full swing, many people still don't understand how overwhelming it can be to safely travel with a primary immunodeficiency. Fortunately, IDF has composed a comprehensive travel guide to help you navigate some of the more complicated parts of traveling. The travel guide covers a wide range of topics from TSA to medications and supplies, as well as unique considerations you should discuss with your doctor before traveling. For more information, visit primaryimmune.org/travel or click the link in the show's description.
Can you talk more, Melissa, about any of the emerging mental health needs that you and your team identified as part of this uncertainty work?
Yeah, and I'll just also kind of agree. It really was so moving to hear all the stories from families throughout the course of the project, and then use that information to develop resources to support not only them but the entire SCID community. And I think, our team and the broader SCID Compass team really felt like that was the best way to meet the goals of the project, was to kind of involve those families in everything we did. So I know you mentioned Heather Smith. She was, of course, one of our really close partners throughout the course of the project. And like you said, it really helped us connect to those families so that we can listen to them and learn from them, honestly. And I think one of the important things that we heard, during the course of the SCID Compass project, I think importantly, the second half of the project was during the COVID pandemic. And we heard from those family voices that things shifted and changed, over the course of those 4 years. And as you mentioned, one of the kind of last resources that we developed that was really I think important and kind of shed light on parent mental health, during the pandemic, was the video that we created. So that was really important activity.
Yeah, I think the mental health video is one of my favorite things that your team created. I really think that it addresses the topic of mental health and coping in such a compassionate way, and really lets people know that it's okay to focus on yourself when you realize that you need it. And it's such a great resource that anyone can benefit from it, no matter the diagnosis they are navigating. It's not necessarily a SCID specific resource, though you interview parents of children with SCID specifically, but I think anyone would really benefit from it.
Yeah, I think, like you said, the mental health video was one of my favorites too. And as I said, it came at a time when talking about mental health was really starting to emerge a lot more, like I said, as a result of the pandemic. But it was really important, like you said, to hear directly from parents who had a child with SCID about their struggles with mental health, and even more importantly, how they addressed it. I think we were lucky to be able to also hear from a clinical social worker during the mental health video, and she gave some really important and great recommendations for different tools or resources that families can use, and really encourage families to reach out to others in the community, but also make their child's provider aware of it's not just a SCID diagnosis doesn't just affect the child, it affects the whole family. And I think that video really helped to highlight that mental health is something that we can all talk about, which was just fantastic.
Oh, definitely. I think a good point that you mentioned, Melissa, is that this all came around because of COVID, and a lot of people were talking more about mental health. And I think that just points out to how kind of nimble our team was, and really realizing, oh, we are hearing this from the SCID community, and we know we need to be able to provide some great resources for them. And we have the capability to be able to provide something like this to them. So kudos to your team for being able to kind of act quickly and pull something like this together when we were all just navigating the virtual world, but still being able to provide something that is essential and really beneficial to the SCID community. So thank your team for that.
Thanks.
So now seems like a great time to talk about some other components of the project that we piloted through SCID Compass, but have now become standard programming at IDF. So again, in 2020, we started offering something we were calling Lunch and Learn webinars on a variety of topics for the SCID community. And we covered all sorts of topics in short little 1-hour segments, from covering the treatments for SCID, an overview of what newborn screening is, to even just something as general as supporting infants' developmental needs while in the hospital. And we got great feedback from the SCID community that this was something that they really appreciated and really were looking forward to tuning into every month. And we learned that our community just really craves some diagnosis-specific opportunities. So we at IDF have now taken this really successful and well-received model and now offer diagnosis-specific webinars for the IDF community covering other diagnoses that are rare, like congenital athymia or APDS or hyper-IgE and more. So SCID Compass has taught IDF a lot about what the PI community needs, and we've been able to diversify that for others and not just those with SCID. We also have learned so much from this project and are really excited to take these lessons learned and translate them into other corners of the PI community, like those lunch and learns. But Melissa, before we wrap up, can you share RTI's perspective or maybe some lessons learned from yourselves from working on this project?
Yeah, this project really encapsulates the phrase "it takes a village." I think, one of my lessons learned was it was so important for us to have all different types of folks involved in this project. So, RTI as a nonprofit research institute, brought one lens to the work. Certainly IDF and Heather in her role in SCID Angels for Life brought the patient experience. But then we had the state lab, newborn screening labs, represented through APHL and Genetic Alliance, also with their work in educating families around newborn screening. So it really was such a great team of folks to really address a big need in the field once SCID became kind of standard practice for states in their newborn screening programs. And I think the other thing to me that really hits home on this project, including, like I said, not only working with the great team and listening with families for sure, was it really, again, kind of to me was a great representation of, I know I had mentioned earlier, RTI's kind of mission is to improve the human condition, but our tagline at RTI is turning knowledge into practice. And to me, SCID Compass is exactly that. We took, a research lens to really better understand the needs of the community, but then really made that actionable. And through such great, funding and support for HRSA, we're able to develop a really wide variety of different types of tools and resources for the community that, like you said, Alissa, can be used as like a template for not only other kind of activities that IDF pursues in immunodeficiencies more broadly, but also in the newborn screening community. So all in all, I think it was just a wonderfully successful project, and I was so proud to be part of it.
Oh, thanks, Melissa. Yeah, we really enjoyed working with your whole team. And like you said, it really did take a village. IDF could not have done this on our own. So it was great to come together with your team, the amazing APHL team. I learned so much about newborn screening and have such a greater appreciation for all the things that a tiny little blood spot can do, and just learned so much from their team as well. And I also just think, similarly to RTI, IDF's mission is to really improve the diagnosis, treatment, and quality of life of people affected by a PI. And I really think this collaboration and what we created with SCID Compass has really kind of hit the nail on the head and been able to support so many individuals, not just in the US, but across the world. We can see so many people not in the US, but in Europe and in Africa and Asia who are downloading all of our amazing resources on SCID. And it just shows how valuable everything that we created is to the people who are navigating this, what can sound like a very scary disease or condition. So we are just eternally grateful for this wonderful partnership and RTI being such a great partner. So I think that's all the time we have for today. So again, thank you, Melissa, and just your entire team. I know you're here representing all of them, but we are really grateful to the many, many individuals at RTI who joined us on our regular calls. And we could not have made such an incredible impact without all of your expertise. So thank you.
Well, thanks, Alissa. It really was an awesome project.
This podcast is a service of the Immune Deficiency Foundation. If you like our show and want to learn more, please subscribe to this podcast so future episodes will be sent to your device automatically, and leave us a review on iTunes so that others may discover this podcast as well. To learn more about primary immunodeficiency and the PI community, please visit the IDF website at www.primaryimmune.org or click the link in the show's description. For more information on how to get engaged in advocacy on behalf of the PI community, check out IDF's Patient Advocacy Engagement Toolkit at www.primaryimmune.org/patient-engagement-toolkit. And if you have a question you would like answered, email us at idf@primaryimmune.org. Thanks for tuning in.